our approach has really been to work more closely in the community. We do a more barbershop programs, we go to churches, and this particular video is all about using the church to improve how people eat at home. Because although people go to church on the average 1 day a week, what happens there carries on for the remaining 6 days.
I'd like this to be the beginning of a national campaign. It's already taken off. Maryland Public Television has aired the documentary. Others are going to air it. It's available online. The DVD is free. I mean, the Association of Black Cardiologists is so committed to this, they're giving away the DVD. And you heard the founders up here, from the youngest members to the oldest. I mean, this is the beginning of a movement. We have got to stop looking at ourselves as victims and poor me and I'm entitled to this food. This is all I've got. It's not a socio-economic issue with us. It's a life or death issue.
I think it's a tremendous event that is long overdue. People need to be aware of what is going on and become label readers and become informed consumers. The American Black Cardiologists are doing a major service for the community by letting them inside the real mechanism of how our bodies work and how our bodies are influenced by what we eat.
The main focus of the organization is really one, to mitigate this epidemic of cardiovascular disease, and secondly, to eliminate disparities in cardiovascular disease across all races.
The reason it's so important is that it's one of the leading causes of death in the nation, and it's preventable. It is the leading cause of preventable death in this country, and simple lifestyle changes can make a world of difference. Just exercising and eating right can extend your life for years and generations, and we can improve our health, and prevention is the key. And so,
when I had my heart attack at age 42, I wasn't thinking about my health. I was thinking about my job. I was thinking about making as much money as I could. I was thinking about establishing a career, taking care of my wife and family. I worked out, but I worked out stupidly, and if there was some pain or whatever in the stomach, I'd do a few more sit-ups and push-ups and all that kind of silly stuff. I wasn't watching a diet. I would have red meat for breakfast, for lunch, and for dinner because I really didn't care. It wasn't an issue for me. I tell people all the time, my heart attack was the best thing to happen to me.
We love to eat. Everything happens around food, and we can still eat, and we can have things happen around food, but we modify what we eat and how we eat it. And you don't have to give up everything, but just in moderation. And that's what this film is about.
The traditional methods of dealing with this issue are clearly failing. If you look at rates of diabetes, rates of obesity, they are climbing up. When you look at the statistics on diabetes, about 50% of the population have diabetes, or black individuals have diabetes. You look at obesity, the rates are going up the charts. So we really need to use different approaches, and we know that in black communities, the ministers are very powerful, and we need to enlist them in this fight.
My business is giving life back to people through healthy eating. Created a line of seasonings that are all natural, that have no salt, no chemicals, no MSG, and they're designed to have people take ownership of their diets back by eliminating the harmful ingredients that are in most prepared foods.
I say to women, for example, you want to be around for your children, you want to be around for your grandchildren, and our children watch what we do. They don't listen so much to what we say, they watch what we do. So let's start setting some examples. We can do this. We can reverse heart disease, which to me is the message. We don't have to be sick, and if you've got your health, you got a shot at anything.
The reason it's so important is that it's one of the leading causes of death in the nation, and it's preventable. It is the leading cause of preventable death in this country, and simple lifestyle changes can make a world of difference.